In our last tip, we learned that thyroid can play a huge role in weight loss and that many thyroid problems are undiagnosed, and those that are diagnosed are quite often handled in less than an optimal fashion. So there are 6 basic patterns of thyroid dysfunction that can cause you to gain weight or hinder your ability to actually lose weight. And only one of them can be effectively addressed by the most common thyroid prescription medications. Now, the first pattern is what we call primary hypothyroidism. In this case, for some reason, we don't always know why, your thyroid can't produce enough T4 hormone. If this is the case, if this is the only problem going on with your thyroid, then prescription thyroid medications will handle your problem. You'll feel better, you'll have more energy, and you'll lose weight. If you go on these medications, it doesn't help your energy level, you don't feel better, and you don't begin to lose weight, then this is not your main problem. Pattern number 2 is what we call hypothyroidism secondary to pituitary hypofunction. Fancy name, basically pituitary gland in your brain helps control your thyroid. If that's not working, it's not sending the right messages to your thyroid gland to actually produce the T4 that your body eventually needs. Now, this is often due to chronic stress, being postpartum. It happens very common after childbirth, and it also can happen from being on thyroid medications at too high a level for too long a period of time. If you have this type of problem and it's not addressed, your thyroid medications aren't going to help you lose weight. The third pattern we want to talk about is thyroid underconversion. Your thyroid produces mostly T4, but the cells in your body use a hormone called T3 to actually function and control the metabolism. T4 is converted into T3 when your body needs it. And in the case of underconversion, your body is having a hard time doing that. When there's not enough T4 being converted into T3, your body acts like it doesn't have enough thyroid hormone, and it can cause weight problems and fatigue and energy problems. This instance of underconversion often happens with chronic inflammation and what we call lipid peroxidation. Basically, one of the causes is taking medications that get your TSH back to normal, but not handling the underlying problem, and people have problems losing weight. The fourth pattern we want to discuss is thyroid overconversion. Well, gee, I'm overconverting my T4 into T3. There's a lot of T3 going around. That must be a good thing as far as losing weight, right? Actually, it's not. Basically, if you have too much of anything, the receptors or the cells in your bodies start to ignore it. With thyroid overconversion, your cells become desensitized to T3. So your cells are acting like there's not enough T3, even though there's more than enough around. Once again, this is going to slow your metabolism and fat burning capability. See, this problem is quite often caused by blood sugar problems like insulin resistance. And it's estimated that up to 40% of the country is going to be considered insulin resistant within the next 10 years. This is also often found in women who have polycystic ovary syndrome, and also anyone who takes testosterone, whether it's a male or female, on different types of hormone therapy. The fifth pattern is what we would consider thyroid binding globulin elevation. So your thyroid produces the T3 and T4, and it needs to get to your cells. Well, they get stuck to a protein in your blood that carries it wherever it's needed. However, if there's too much thyroid binding globulin, that T4 and T3 never gets released. It stays bound. It stays stuck to that protein. And when it's not released, it doesn't get to your cells. So even though your levels may look normal, you have normal amounts of T4, normal amounts of TSH, maybe even normal amounts of total T3, your body acts like it doesn't have enough of the hormone because those hormones can't get off of that binding globulin and into the cells. This problem is usually caused by hormone problems, especially things like estrogen. So women who are having hormone problems related to estrogen, maybe if they're taking the birth control pill or on hormone replacement therapy, This is a pretty common mechanism. Even men who are insulin resistant, when men are insulin resistant, their estrogen levels rise, their TBG ends up rising, and it causes problems with the thyroid system. They're going to prevent you from being able to lose weight. But if you don't look deeper, you're never going to know that you have it. And finally, the sixth pattern that we're going to talk about is thyroid resistance. Now, your thyroid and your pituitary gland are absolutely fine. Your body's producing enough TSH and thyroid hormone, but for some reason, your cells are not absorbing it. Thus, when you take your TSH and T4 levels on blood work, you look normal, but you have all these thyroid problem symptoms. This is usually caused by elevated cortisol levels. Cortisol is a hormone produced by the adrenal glands in relation to stress. So if you're under stress, your thyroid may look like it's normal when they do basic blood work, but it's still not functioning the way it should. It's not helping your body, and it's causing you to have problems maintaining the ideal weight. So remember, optimal thyroid function is crucial for your ability to lose weight. However, identifying which particular pattern you have takes a lot more than just ordering a TSH and a total T4. That's where I come in. In the next chapter or the next set of these tips, we're going to talk more about the proper testing or the more thorough testing that's needed to get to some of these patterns of thyroid dysfunction that are keeping you from losing weight. As always, this is Dr. Smith helping you with the keys to lasting weight loss.